Hi, I'm Nicole, licensed clinician, and we're here to talk about just everyday things that happen that influence our mental health and fitness. We've talked a little bit about the difference between big T traumas and little T traumas and how those can impact us for the immediate and then also for the long term. But then also there's ways that different experiences can prime us for certain responses to certain things. So let's say you have some experience that have caused you to be a little bit hypervigilant, or a little bit anxious, and then you're running a little bit late for work or for an appointment and something happens, like maybe you get cut off in traffic. Now, for somebody who's not hypervigilant or not a very anxious person, that might not even register on our radar. For somebody who is more hypervigilant or anxious, that might be something that just kind of throws the day off or throws off the mood in that moment. And so there's ways that we can kind of bring it back and reset ourselves a little bit. And if you are one of those people, I would highly encourage you to engage with your own therapist so that you can really tailor your responses in these types of situations. So do you have, I hate the word coping skills. I hate the word coping skills so much. Maybe I'll do a video on that at some point. But for lack of a better term right now, what coping skills do you have to use in those moments when, you know, you really just want to like lash out at somebody because you're already stressed out? How do you bring yourself down? Some things that can be helpful are things like box breathing. So you can close your eyes, or not close your eyes if you're like driving, and breathe in to a count of 4, breathe out to a count of 4, breathe in to a count of 4, breathe out to a count of 4, and then keep on going around the square. And while you're doing that, you're envisioning drawing a square. Or, you know, maybe you can even do it like with your finger if you need to, if you need a little bit more of that like visual like stimulation. So these are some things that you can do, and I really want to be able to give you something to take away from at least the majority of my videos.